And then Mitchella, coupled up with the dandelion, again, would be certainly if I see a lot of bloating, water retention. Um, and again, maybe this woman also complains of getting up often at night and having to urinate at night. And often that's a stress sign. That says that, again, cortisol is robbing away antidiuretic hormone, and it's, agitating the whole kidney function piece. So Mitchella and the dandelion leaf makes a nice couple because they're not going to let's say stimulate the urinary system. They also work as tonifiers, and they are astringent, so they help to minimize irritation in the mucous membranes and in the kidneys, which is one of the reasons why we get diureses. So with these pelvic congestant or decongestants that we're going to be using if a woman has symptoms that lead us to believe that pelvic congestion is part of it, it's really a good idea to combine them with some circulatory stimulants. And circulatory stimulants in herbal medicines are our warming herbs. They're the herbs that are thought to, warm the tissues, to bring circulation and blood into the area, and to perfuse into the skin, and to help to lead or influence herbs moving into the pelvic area. And we know that ginger commonly has been one of those. Cayenne or capsicum can certainly also be used, and particularly when you know that there's small vascular participation. So that might be one of the herbs that you would use in a small amount when you're trying to get vascular tonics into the pelvic area. Cinnamon is very warming, but it's not quite as intense or dramatic as the capsicum, and many people actually find that to be very helpful in soothing their stomach if they have any types of stomach upset in their menstruation time. Then using that as part of it. And then rosemary, and rosemary can be added here at both as a circulatory stimulant and also as a overall overall herb to help to warm and relax musculature and the overall kind of muscle layer of the vascular system. So ginger certainly would be one of the circulatory stimulants, as I mentioned, and traditionally it was a herb that was thought to, actually lead many more herbs into the pelvis. Now we know that it brings in an anti-inflammatory action, and the anti-inflammatory action also is very important to help to minimize a buildup in inflammation in the pelvis, because as I said earlier, generally when menstruation is coming about, the body gets ready for that and stimulates a wee bit of inflammation. And if that's happening there, we want to make sure that if there's other inflammatory dynamics that are overstimulated because of lifestyle dynamics or different types of disease or chronicity of disease in the person's lifestyle, we may find that contributes to upping the symptoms, so upping the discomfort and or the bloating or the sense of tenderness in that organ. Now the ginger also is warming, and we know it also acts as an analgesic, so it helps to minimize discomfort and pain. So overall, this would be a nice addition in helping to, warm the area, because when we're congested, things cool off. It helps to minimize some of the discomfort that's going along with that, and certainly it also brings a nice flavor or a nice little addition to a herbal medicine, particularly if you're using a combination of tincture extracts that might make it a little bit more palatable.